Hello, everyone. Welcome to this CG Zest Wellness webinar titled A Common Man. What we're going to do is just going to start to share the slides here and get started.
Welcome to the webinar. You have entered as an attendee in listen-only mode.
Okay, fantastic. Naval and Donovan there, can we get a quick technical thumbs up if you can see the slides?
I can see the slide, the flyer, A Common Man, yes.
Yeah, I can see the flyer as well.
Fantastic. Everyone, welcome to this webinar. Our wellness team is always extremely excited to share this with everyone, and we're so thankful for everyone who also registers for these webinars, because the more individuals who can hear this type of health information, we hope to bring more of these healthy habits to individuals and really help others. So today's webinar is all about men's health. That's what the topic is all about. And the title is called A Common Man. And so the way this webinar is structured is we have 4 speakers. We have myself, Nathan Kolar. We have Mr. Glenn Duran. Glenn, do you mind saying hello to everyone?
Good afternoon, everybody.
Hey, Glenn. And then we have Naval Miller as well. Naval, how are you doing?
Pretty good, man. Good day, everybody. Thanks for joining us.
Fantastic. And then we also have Donovan Ingram. Hey, Donovan.
Hey, Nathan. Hello, Glenn. Hello, Naval. Hello, attendees.
Fantastic. So on behalf of us, your presenters, and then as well the entire CG Zest Wellness team, which it's always nice to give recognition to individuals for all the effort everyone puts in, and that's Jacqueline, Katie, Sharon, Ali, all these individuals, other members of the CG Zest Wellness team. So what's amazing about these webinars is we're sharing, health content, but look at this community we're building. And so this community we're building, we can then bring this to our family members, we can then bring this to our neighbors, and we can all support each other. So not only are we learning actual health and wellness knowledge, but we're really building this fantastic community. And so from this webinar today, if there's any topics that really resonate with you and you love to learn more, feel free to reach out to one of the Zest Wellness team members, and we can dive further into a specific health topic for you. So if anything's of interest, always feel free to reach out to the Zest Wellness team. As well, this webinar will be interactive, and so that means there's a chat feature below. And so when us, your presenters, share questions, we'd love to hear your input, your answers, your thoughts, your comments, and you can put those in the chat box. You can type them in, and then the presenters, we will see that, and we can engage in dialogue back and forth to help make this engaging and to also hear your feedback and input, because above all, your voice does matter. And with that said, we're going to get into the first topic of this Men's Health webinar with Donovan Ingram, which centers around nutrition.
All right, thank you, Nathan. Just before I get started, Nathan, I noticed you don't have a mustache growing there. I see some sprinkles, but I just wanted to compliment you guys for your creativity and your mustaches, your bags this November in celebration of men's health. And when Glenn joins, I'm sure he's going to show us his facial expressions as well. So kudos to you, and we hope that the attendees also follow suit and raise some awareness about men's health. So thank you for joining us today. It's important for us to start with some precedents here and give some perspective as to why this webinar is being hosted. And it's my job to explain the obesity risks of men in various Caribbean countries and speak to those risks as a highlight to the diseases in which they are at risk of, and then also the nutrition recommendations needed to improve obesity and likewise the health risk of men. On this slide in itself, and that means that these trends of obesity are not slowing down at any point. So webinars like this give rise to awareness about obesity epidemics, and also give rise to the need for individuals to make personalized change, to which Naval, Glenn, and yourself are going to speak to, and myself. It's also important to note that obesity amongst the male population for most Caribbean countries seem to be lower for men than it is for females. So the females tend to be the heavier, more obese individuals in society, and that's not knocking them, but kudos to men in terms of maintaining that. And I'm going to come back to that question to our panelists, just to raise awareness in terms of why do you think men are likely to be more fit, less obese than females in most Caribbean countries. But it's also important to note that with a high risk of obesity amongst men, that increases the risk of disease tenfold or threefold in some cases. There's the risk of hypertension, there's the risk of diabetes, and then there's a risk of a series of cancers that Naval and Glenn are going to get into. Prostate cancer, testicular cancer, but some unknown cancers or unspoken about cancers regularly are pancreatic cancers. Men should be aware that the bigger they are, the larger the individual, the more distended the stomach or the arms, the chest, or the hips area, that may say increases their risk factor for pancreatic cancer. It also increases the risk of other issues like erectile dysfunction or even issues with sleeping habits. And it's something of major concern amongst men. I think you should know that you need to control your health. You need to aim for a BMI of 25 or less. That's the normal range. Anywhere over 25 is considered overweight, over 30 is considered obese, and anywhere over 35 in BMI values is considered morbidly obese. So all males should aim to have a BMI less than 25. Additionally, we should be more concerned about our percent body fat, and we should aim to have a percent body fat within range. Now, I can't remember the exact range of an average male percent body fat, but if memory serves me correct, it's around 25% or less. It tends to be a healthier percent body fat for males. So my first question to the audience is, what are ways in which we can, or what are some other diseases that you think males are at risk of when it comes to obesity? If you can use the chat feature at the bottom, just get that conversation started in the chat first, send us a few messages, let us know some diseases you think men are most at risk of when it comes to the obesity epidemic based in several Caribbean countries. And going back to my panel, guys, why do you think men tend to be less obese than females? I'll start with Naval, since I can see you first.
So I think that females have breasts, right? They have hips, much wider hips than males as well too. So I think those are contributing factors of why females would be categorized as being much more obese than men.
Yeah, that's a good answer. Women do tend to carry a lot more body fat because they have mammary glands. In fact, their organs need a little bit more cushion for I won't say the other part of the saying, but they need a bit of cushion for protection. They are the carriers of babies, so they need to have a lot more fat glands around a lot of certain vital organs to provide support for those organs. Yeah. Nathan, any feedback from you?
I'm thinking about this from maybe it's nice how Naval just brought up from a science perspective and a biology perspective, and I wonder even from like a psychology perspective or a body image perspective, it's women might not think it's okay for them, or they think if they go and exercise, they're going to get too big of muscles. They automatically assume exercise with large muscles, which we know isn't the case. Whereas with men, it's almost like as a society, we might think it is more appropriate for men to be lifting weights, and so therefore they do engage in physical activity. So I wonder if it's also like kind of there's that body image and psychology side to it.
Yeah, and Nathan, you've hit a very interesting point. In fact, I know for a fact in the Bahamas, females like to be a lot more heftier because they feel that men are more attracted to them when they are exposed to a little more meat on their bones. And so I think it is a mental thing in terms of females wanting to be bigger, men wanting to be more muscular. Those are things and stigmas we need to work through in conversation. And I think you're going to kind of dig a little deeper into that. So I won't steal your thunder on that, but very valid point.
Yeah.
And Glenn, our last panelist. So what's your thoughts on the obesity amongst men and female? Why do you think men tend to be less obese than females?
Well, aside from the physical and the physiological aspects that were already mentioned, like women having more adipose tissue because they have different organs that are required for their gender because they bear children and things of that nature. But aside from that, I think men are generally just thinking more culturally. And I think this is a global culture, is men are more interested in activities like sports and things of that nature. So they may not necessarily be fitness enthusiasts, but they may be sports enthusiasts and be more willing to engage in these I guess high output activities. And when I say high output, I'm talking about calories. And simplistically, weight management is making sure that you expend more calories than you consume. And I think men do that by default. And also within the workforce, if you look at a lot of the, blue collar jobs that are quite laborious, men take up those jobs. So I guess they're advantageous in that sense. So those are some of the contributing factors from my view.
I love those answers, Glenn, and I totally agree with you. I find that men are a lot more active when it comes to exercise. It's second nature for men to go out, play sports. As social environments, we want to play basketball together. We're very competitive, so we want to be the best at every sport possible. That's for football, tennis, soccer, every aspect of sports. And I think naturally men like to go out and do activities. They don't mind getting sweaty and a little dirty. So those things are never fair for them. And that's what keeps their BMI and their percent body fats within check. And then again, your point to the blue collar jobs, yeah, men do take up more industrial jobs. They are the lifters and builders of society. Even in the office space, men are seen as the option of lifting the boxes or moving cargo around the office space, more than females are. Even the water cooler, changing the water bottles, men are responsible for those aspects. And I really want to encourage men. I think a point raised by all of you, an encouragement to men is that we need to stay very active to remain within a sustainable BMI and percent body value so that we lower our risk factors for health outcomes like prostate cancer, testicular cancer, pancreatic cancer, sleep deficiencies, or even erectile dysfunction. All right. Thank you. That's my slide. Thank you, Nathan.
All right, so now we segue and we're going to get into the topic that I'll be covering today. I'll be discussing testicular cancer, which, in my research I found is not as prevalent as I originally thought it may have been. But just to kind of give you just a broad overview of testicular cancer. So obviously cancer is kind of determined based on whatever region of the body it actually starts in and then it spreads. That's just the general function of cancer. There's different types of testicular cancer. And based on that type of cancer, that kind of determines what type of approach needs to be taken to manage the actual disease itself. So it's not really a one size fits all because it just all depends on what the doctors find underneath the microscope, how advanced the disease is, and it doesn't seem to be too aggressive. And like I mentioned before, it's not all that common. So it's statistically, it's 1 out of every 250 males that actually develop it during the course of their lifetime. And something that I found quite staggering that I just did not know as I was researching this, that the average age of diagnosed males with testicular cancer is 33 years old. So
Well,
it is very much so, I guess, considered a young person's disease, where traditionally cancers are kind of known to be more prevalent in older individuals. So, you know, the other stats on that would be that it's found in about 6% of children and teens, and only 8% in men that's actually over 55 years of age. So that kind of blew me away as I was going through the research here. It's typically treated quite well. The mortality rate is low relative to other cancers. So there's other cancers that some of us have seen that are really aggressive, such as pancreatic cancer. Breast cancer can be that way. But the key, you know, the key to managing this, like all cancers, is just early detection. So just kind of finishing up on the testicular cancer, just kind of questions that I'd like to ask the panelists today is how can we actually encourage a male family member, or, you know, motivate them to utilize resources to make sure that they get these types of things, keep them in check. So meaning, how can you encourage them to go to their general GP and get their checkups and catch these things early? Any feedback on that?
yeah, I'd like to start. I'd like to say, you know, it's a big stigma when it comes to men and going to see a physician. That's something that's not very common in many Caribbean countries. And I think to encourage men to go out and get these checks done and completed, to know their numbers, they may need to be kind of scared in a sense, scare them in terms of what are the genetic history of the family. You know, is it likely for this disease to happen amongst men in their family, and then really encouraging them to take some preventative care action if it is a high risk within that family.
Yeah, from I guess from the like from the company point of view, um, it might be, or it could be that someone, they think this is important, but what if they're so busy at work that they can't, or like they're busy during the day. So like to say to someone is, if you're an employer listening to this webinar, especially if you're a manager in a position of influence, what we can do is we can just support our employees in terms of possibly reminding them or telling them it's okay to go out in the afternoon and have that appointment and take 1 or 2 or 3 hours away from work. It's okay to do that. It's like people might not actually think they have permission to actually go do that. So that's, I think, how we can all help, especially for someone who's in a managerial position and from like the employer side.
Yeah, and my feedback would be having more conversations about these stuff. Before you present this, I didn't know all the facts and stats that behind testicular cancer. And matter of fact, when we were just talking about creating this webinar, I was like, testicular cancer was, I wouldn't say a new word for me, but obviously I haven't, I have no information about it. So definitely having these type of conversations and making these type of conversations a welcoming one. Similar to when females have conversations about mammograms, right? They speak about these things very comfortably. Whereas, for men, when we say testicular cancer, or my next subject, which is prostate cancer, it seems like, oh, we don't want to talk about that. So just having these type of conversations and raising awareness.
Awesome. Great answers, guys. Thank you so much.
Thank you, Glenn.
All right, let's segue right into my slide. I have the prostate cancer slide, and I must say, guys, that just working on this presentation from a prostate cancer perspective, well, sharing information about this provided me with a lot of information myself, a lot of things that I did not know about prostate cancer, and information I can share to my family members as well too. So it was beneficial to me, as I'm hoping that it will be beneficial to our audience as well. All right. So what is prostate? All right, so prostate is a part of the male reproductive system, which includes the penis, the prostate, the seminal vesicle, and the testicles. Where is the prostate located, right? So we had this conversation about prostate cancer, but a lot of people really don't know where this prostate gland is actually located. So if you're looking at the slide right now, you can see that it's magnified a little bit. So the prostate cancer is right under the bladder. It's right in front of the rectum, right? And as you can see the long purple line here. This is the urethra, right? So this is where the prostate gland is actually located, right under the bladder, right in front of the rectum, right? And the urethra runs straight through the prostate gland. So the prostate, the main function of the prostate is actually to provide fluid to the sperm cells, which create semen during ejaculation. So the prostate actually supplies the sperm cells with semen, almost like a lubrication. So when ejaculation happens, it's not just the sperm cells, but it's also the prostate gland supplying that fluid for, I guess we would call it easy travel per se, right? Now, the prostate cancer. So what is prostate cancer? So prostate cancer, almost to what Glenn mentioned just now, is the cancer that develops in prostate. And usually the cancers take the name, the cancers usually takes the names of where the cancer is actually located. So this one is a growth in the prostate gland, and that is called prostate cancer. Now, usually, especially when they do their screenings, all growth in the prostate gland are not cancerous. There are some prostate glands that have growth in it that are benign. It's similar to when females have their mammogram testings and when they feel lumps in their breasts. Some of those lumps are benign, right? That means they're non-cancerous. Now, in certain instances, those lumps may also be malignant, which are considered cancerous cells. So not all growth in the prostate glands are cancerous. Similar to when ladies feel lumps in their breasts, not all are cancerous. Some are benign. All right, so who is at risk for prostate cancer? First off, all men. All men are at risk for prostate cancer. And the most common risk factor for prostate cancer is age, right? So prostate cancer is a type of cancer that develops with age, right? It's really, during my research, is no real scientific way to prevent it. That's why they consider it an age cancer. It's just that in order to tackle it and have success where the cancer is not spreading, it's early detection. But I wouldn't jump into my spiel with the next slide in regards to screening. However, though, one of the statistics I also found out is that Black men or African descent men are more likely to develop cancer. All right, they are more likely to die from cancer as well, and cancer grows much more aggressively in Black men. Now, during my research, just to dive into that a little bit more further, because obviously I'm a Black man. There are internal factors in regards to genetics, which contributes to that, but also we must be aware of the external circumstances. So I read the study from JAMA Oncology Study. It's JAMA Oncology Study, and they did study with SEER, right? So SEER is a surveillance epidemiology and end results. And during this study, SEER came out and say, hey, the underlying factor for prostate cancer growth in African descent men is due to genetics, right? But they left out a lot more variables, right? So they did a collaborative effort, collaborative research with University of Michigan, and University of Michigan included those variables, and they found out that, and I'm going to read it word for word right here. This is like Dr. Daniel Spratt. He states that, right? Says the data shows that Black men don't appear to be intrinsically and biologically harbor more aggressive disease. They generally get fewer PSA screenings, are more likely to be diagnosed with later stages of cancer, and are less likely to have health insurance. So it's basically leading back to the conversation of having these type of screenings in a timely fashion. And that's one of the key reasons why you'll see prostate cancer more prevalent in Black men compared to any other race. All right, so let's jump into the symptoms. Some symptoms that men may experience if they have prostate cancer. One is weak or interrupted flow of urine. Second sign is a sudden urge to urinate, trouble starting to urinate, painful and burning sensations when you're urinating, blood in your urine or semen in your urine, pain in your back, hips, and pelvis, right? Breathlessness, tiredness, dizziness, and anemia. So basically, these are some of the symptoms that associate with prostate cancer. But nonetheless, there is also a study that shows that a lot of times when men have prostate cancer, no symptoms are shown at all. So that's why the screenings are very much important. But I'm not going to steal the thunder of my next slide. But one of the questions I wanted to ask the audience on my panel today is, just going to pull it up right here, is what suggestions would you give to ensure that the conversation about prostate cancer is a welcomed one? Now, for me, I'm going to start it off. I think that we need to have more conversations about prostate cancer, testicular cancer, men's mental health. I think there needs to be much more of a welcome conversation. I grew up in a beauty salon with my aunt. I have witnessed many conversations about mammograms, and it seems like they just flow with it and have a real good conversation about it, right? And it becomes more, welcome. The awareness is raised. So it's the same thing where I think we should encourage amongst our men to start off this conversation and have webinars such as this. But let me hear what my panelists have to say first. Let's go, Nathan.
Hey, Naval. Hopefully individuals or know, and to make these conversations more effective, is that we actually don't have to know the answer. And so the last thing we want is someone to think that if they are experiencing symptoms, that they themselves have to know the answer, where it's not that we have to know the answer, it's that our role is to go seek someone who might know the answer, like a qualified health professional. So to make these conversations better is, and Donovan alluded to earlier, it's about, like, if you and I were chatting, we could help each other by raising awareness about it. But you nor myself nor anyone listening, we don't have to know the answers. Like, we can go seek support or get checked, and we're not expected to be an expert ourselves and to know the answers. The medical professionals, that's their role.
Right. Good answer, Donovan.
Yeah, and I think just kind of piggybacking off of what Nathan mentioned, just support. I think the greatest support you can get is from your insurance provider. Just find out the information in terms of what coverage is supported for prostate checks as males. If you don't have insurance and you're a listener or attendee on this webinar today, then I'm sure that there are free resources that are offered through public systems or public health hospital systems that allow for PSA testing or prostate invasive testing. Maybe even having a conversation with a physician and identifying what those key signs might be towards prostate cancer. And if you have a family physician, or you have a physician that you commonly see or you can call for anything, if you have a cold or you have a headache or you have some discharge in your urine, having that physician as a support where you can just pick up the phone, call them, ask them some questions, definitely does lend more to better support for the individual, more so for the male. And I think to add to that, having a supportive female, having a female that's aware of what's happening with you health-wise and having that proper on a regular basis about what you're feeling, what symptoms you may be experiencing, that lends to a better support as well.
I like that. I really like that. That's a good answer. Go ahead, Glenn. Let us know what your feedback is.
Well, I think having just general education about prostate cancer as a man is really important. And that, I mean, personally, that would be a motivating factor for me, just understanding things like how prevalent is it, in particular, like in the region that we live in. And, we may not necessarily know why that is, but it definitely is a thing here. And just sharing those statistics and helping our our loved ones really understand that the true key to like surviving these things is, number one, is early detection.
Right.
Early detection cannot happen if you have not made if you have no habitual functions in your life that allows you to go to your GP and sit down and have like your regular annual checkup, because sometimes it can be detected in there just doing regular annual blood tests. If something's happening with your, you know, your blood cells, sometimes that's a red flag, and then they can take a deeper look into what's actually going on. So, you know, maybe, you know, just to simplify it, finding a way to say, hey, listen, every year on your birthday, go get your annual. That way that you don't forget, and you know, you put it in your calendar there. So if not on your birthday, somewhere near around it during the month, but just make it a habit. That way you have a fighting chance when these things rear their ugly heads.
Yeah, I agree with that as well too. Early detection. Early detection. Thank you guys. That's my slide right there.
Okay, and here we are with a men's health slide that's related to mental health. What we're going to try to do with this slide is we're going to try to paint a picture together to really kind of grasp the concept. And we're going to start with the phrase why this is not about blame nor shame. So no blame nor shame. And just like Naval, when he was speaking about the last slide, you can tell that Naval was using everything he talked about was evidence-based, which is how we want to go about educating others is through evidence-based research. We're going to start with an evidence-based concept, which tells us that, hey, when we look at someone's health and well-being, you can see there's multiple factors that come into it. Yes, genetics plays a role, but also the healthcare system itself, also an individual's behavior, their healthy habits that they practice, even the social and environmental factors, things like violence in the community, air quality, all these types of things impact our health. And that's all to say that our health isn't just it's not this as simple. There's all these different factors that come into it, and so the responsibility isn't like, hey, let's just tell this person do this, do that, but we need to create the conditions around someone in order to really help them be healthy. And so what we mean by that is if we look at someone's behavior or if we look at someone's emotions, we can point the finger and say, hey, you, the individual, need to practice these behaviors, but also what influences the individual is their social support or the environment around them. So it's tough to be healthy and to eat healthy when there's first not healthy food in the refrigerator. And so it's this balance between individual accountability, but also structural accountability. So you can see it's not always on the individual, it's also on the conditions around them. The environment could be, it's how can we create healthy workplace environments to support the individual and their own behaviors. And then so, okay, you think, okay, so Nathan, we agree with what you're saying, and we appreciate how Zest is setting the stage about trying to share how health is complex. There's always a number of factors that come into it. And then even if we say, okay, if we look at the individual themselves, if they're not practicing a healthy habit or if they're in a state of poor health, is it because they can't do something or are they not motivated to do something? So two very, very different things. Is it someone they can't do it or they wouldn't do it? And so there's this difference between motivation and ability. And that's all to say that you can just see how there's these different types of factors that could possibly play into what Donovan alluded to earlier, which is stigma. And the stigma isn't just the way that we think people think about ourselves. So it's not the other people's thoughts about us, which would be public stigma. It's also what do we think about ourselves, our self-stigma. And then the structural stigma around us are the policies, the laws. Do they discriminate against certain types of conditions, like let's say mental health conditions? And what this slide is trying to share with everyone is that you can see that if someone is struggling in a state of poor mental health, it's okay, and it's it's not only do you have to practice healthy habits yourself and not only just a motivation thing, but it's also how can we help each other and create conditions around each other to support each other. So it's not always the individual or blaming and shaming the actual individual. It's the conditions around the individual, and that helps with us really understanding each person is different. And so if someone is going through a mental health struggle, you can see all these different factors play into it. It's not a matter of, hey, go change your emotion. It's a matter of, okay, is it their emotion, but then are there also factors in their environment and how this plays into stigma for someone. So to anyone listening this, the goal of this slide is to share that, you know, by going through a mental health phase in your life and seeking help, you're not weak, you're actually brave, because there's always other factors that come into it. So you're not weak, you're not brave. And then also what each of us have the ability to do is we can all help collectively as a community. We can really help the idea of both public stigma and structural stigma. So by us telling someone it's okay to seek support or it's okay to have a bad day, we're helping that idea of public stigma. And so that's something that's within all of our control to really help others. So hope that kind of sets the stage about maybe men's mental health and how stigma might play into it, and how for anyone, we don't want to blame them, we don't want to shame them. We know this is health is really complex, mental health is complex, and so all these factors play into it. And so we all have the ability to, with things like stigma, is really ourselves and within our circle of control, make it so that others know that we think it's okay and we're there to support in any way we can. So with that, I'll say a rhetorical question to the panelists here, and we'll go in the order of Donovan, Naval, and Glenn. But the rhetorical question is, do each of you commit to listening to others in a non-judgmental way and to not diagnose anyone in mental health conversations, but to rather simply listen? Do you commit to that moving forward?
I do, and if I can add, sometimes it's difficult putting myself in a position to commit to it, but I understand where you're going with this. But yes, I do, and I make that a practice.
Sorry guys, I do the same thing as well. Sometimes it can be tough, but nonetheless, it's you know, it was one of the best ways you could have a clear decision, or trying to understand something clearly. Hear it from somebody else's perspective, put yourself in their shoes, and I'm sure that, you know, that's the best way moving forward in making any decision, anything.
My answer would be not always, to be honest. And I think that's, you know, that's part of the challenge, is just having that mindfulness and being able to put yourself on a consistent basis in a place of compassion. Albeit that's, you know, that's something that we'd like to expect from others at all times. It's just hard as a human being, I think, to always do that. And I think it just depends on the dynamic of the relationship, how long you've known the person, and it could just be situational based. Maybe there's certain topics or struggles that this person is dealing with that you just lack the capacity to be sensitive to or have empathy for. So I think that answer is definitely a double-edged sword.
Awesome. Thanks for the input from all of you. And we'll go back into another slide here about nutrition and with Donovan.
Yes. So it's also important to understand the nutrients that a man needs to be a healthy man. You know, there are a lot of things that we consume that are healthy, and then there are things that we consume that are not healthy. In understanding this, I want to bring rise to an article that was just published this week by CG Zest Wellness on the CG Zest Wellness blog. If you haven't read it yet, I would encourage you to check it out. It is called Nutrient Essentials for Men in the Modern Era. It was written by yours truly. It speaks to 3 different types of men, being the strong man, the supported man, and then also the reproductive man. And it gives rise to recipes and ingredients. An individual needs to be either or a combination of all those men. In this particular slide, well, we want to make sure that males are eating healthier, and that's why I have a list of items in terms of what they need to consume. It's also important to incorporate these things on a daily basis, using a collection of these items or some of these items in various meals, but identifying with at least one of these ingredients in every meal. That's very important based on what we're going to speak about. And in identifying the top nutrients that are needed for males, it's important for us to go through this list, but also keep in mind, read those nutrition labels that you're consuming these items from. Reading labels is very, very important for all individuals, whether male or female. It helps us to understand, are we getting sufficient amount of those nutrients, or do we need to get more? Some of us have deficiencies, so reading those labels also helps us to meet those deficiencies. And when you do read the label, I encourage you to check out the % daily value, as that is the key to understanding whether an item is low or high of any nutrient. And I'm going to come back to that item for our attendees and asking a question to them about that. But in listing these items, things that we need to consume are fruits and vegetables. Fruits and vegetables should be consumed on a daily basis. In fact, the World Health Organization insists that all males or females should consume between 5 to 6 servings of fruits and veg per day. That's particularly because fruits and veg have an antioxidant in it called flavonols. And flavonols assist through research. It's understood that they assist with circulation, they assist with cholesterol values, and even blood pressure values. Another item of importance are soybeans or other legumes and seeds. Now, soybeans being the particular bean that I'm speaking to, that is highest value in terms of protecting men against prostate cancer, but all beans are very effective for that capacity, but soybeans are the highest and strongest value towards protecting against prostate cancer. Legumes such as nuts and seeds like flax seeds, hemp seeds are a big rave right now through society. A lot of persons are hearing about hemp oils or hemp seeds. Those are very highly recommended. Flax seeds, chia seeds, sesame seeds. If we can incorporate these into our diet, we will be guaranteed that we're getting the supportive amount of fiber for digestion, protein for muscle stimulation, and then even zinc for our reproduction needs. Fatty fish should also be consumed. It is recommended by the World Health Organization that individuals, male and female, should consume 2 servings of fatty fish per week. That's highly recommended. If you're consuming it every day, excellent, but minimum 2 times a week is recommended because of the omega-3s it supplies in protecting against heart disease. When cooking, it is recommended that you add an ingredient like garlic because of its antioxidant allicin that it supplies to the body. It helps, garlic in itself helps to improve erection quality and in maintenance. So in men with issues with the libido, if you're not cooking your own meals, recommend to the females that you add some garlic to the item. That helps with your libido a little bit more. Garlic also goes a little bit further in terms of digestive support. It helps with the probiotics and prebiotics in the digestive system, ensuring that nutrients are being absorbed against the gut line, and also helps to move food throughout the gut line so bloating or indigestion does not occur. Red wine is also recommended amongst men in terms of consumption because of the antioxidant polyphenols. Not just red wine, particularly beer. You know, men love their beer. I recommend men get your beer, get your red wine in on a regular basis. However, it is very important to note that men and women, well, men first, should limit their alcohol consumption to maximum 2 servings of alcohol per volume per day. All right, so that's 2 servings of any source of whether it's red wine or beer. Limit those 2 servings per day. Females should limit it to 1 serving per day. Reasons why you want to have your red wine, your beer on a regular basis is because it supports the heart in itself. It supports all muscles function and muscle growth. It helps with brain and cognitive support, getting individuals to be a bit get better at memory and also for brain function. And it also has high values of cancer protection. Another nutrient that men should be aware of is olive oil. And I'm not just talking olive oil itself. I'm speaking specifically about extra virgin olive oil. You know, you go on the shelf, you go on the food store and you see it on the shelf, you see a whole collection of different olive oils. Please, men, female, if you're buying for the men, please ensure that the olive oil you're selecting is extra virgin olive oil. Simply because that form of olive oil has the monounsaturated fatty acids, big word, I like to call them MUFAs, and they also have a bit of PUFAs. MUFAs are the healthy fats that we consume that help to support our circulation of the blood. It also helps to improve libido. So a man feeling stimulated by a female, it helps to support that. It lowers the total cholesterol values, particularly the LDL. The LDL is the bad cholesterol. So we do want total cholesterol to be low. We also want LDL to be low because that also impacts men's fertility level. It also helps. It also affects men's stimulation to have a stronger libido. So extra virgin olive oil. Beta carotene is another item that is the most important for men. If you don't know, beta carotene is the support for eye function, is also support for nervous function, but it also helps with a whole lot of other things. Like it helps to protect against an enlarged prostate. For an enlarged prostate, it means that you're high risk of prostate cancer. It means that you may have some issues with urination. It may also mean that you have issues with reproduction. So be very careful. And it's also very painful. So beta carotenes are very protective against that. If you want to know more about beta carotenes, any fruit, any vegetable that is of an orange or yellow pigmentation, it is obviously high in beta carotene. Beta carotenes lend that color to the fruit and vegetable it is a part of. And so if you want to get more beta carotenes, choose fruits and vegetables that are of orange or yellow pigmentation. Beta carotene also helps to improve sperm count and motility. It's good that you're producing sperm. I think Naval White may have alluded to sperm and sperm count, but it's also important that men are not only producing sperm, but if you want to be reproductive, that the sperm is reaching the fertilization of the egg, and it has to have good motility. One of the things that lends to that is consumption of beta carotenes on a daily basis. Another ingredient is consuming berries, foods like blueberries, raspberries, cherries are very supportive in anthocyanins. That's another antioxidant that's very important for men's health. It helps to protect against cancer. It also helps with memory loss and also thinking skills, you know, being very alert, being able to respond quickly, being attentive to your family members, or being attentive to yourself, as Nathan would have alluded to. It's very important that you consume berries on a daily basis. Zinc is also another nutrient of very, very, very importance to males. A lot of men don't think about zinc. They don't even identify with zinc being consumed in the diet. Zinc primarily comes from shellfish. Shellfish like oysters or shrimps, lobsters obviously have it, but oysters in its highest quantity. And also seaweed. And so when you have your sushi and you're choosing sushi regularly, you are getting an appropriate amount of zinc. So I recommend zinc because zinc is very instrumental to, the sperm has the head and then has a tail. In order for that tail to whip, to cause the motility to move towards the egg, it needs to have the zinc in there to kind of power the tail to move it into the reproductive organs of the female and establish fertilization. So zinc helps with reproduction. It also helps with sperm quality, and it also helps to ensure that the man has a healthy heart and muscles so that you don't have any heart attacks or pains during sexual encounters, you know. And another item of concern, of importance, is iodine. Another item that men tend not to think about. The prevalence of iodine comes mostly from iodized salt. So don't just choose any form of salt. Men should choose iodized salt because it helps to manage weight gain. We spoke earlier about the risk of obesity and the likelihood of also getting other forms of diseases like hypertension, diabetes, or cancers that we're speaking about today. But if you are consuming iodized salt and iodine from that salt, it helps to manage weight. It limits fatigue, and it lowers the T3 and T4 cells that also stir on weight gain. Okay, I won't get in too heavily into that, but iodine helps to manage a man's weight. It keeps the waistline smaller and keeps the male a little bit more muscular physique. Okay, another item of importance is magnesium. Magnesium tends to come from a lot of our soybeans or legumes and our seeds. It helps in protein synthesis. For those of us that want to bulk on or want to get a little bit more muscular during this winter season, you need to have your protein part of your diet. You need protein synthesis. And so magnesium is highly recommended in diet. It also helps with muscle and nerve function. And men who are bulking or putting on muscle, they only think muscle. But what they also should be thinking about is also bone health. And magnesium is very supportive towards bone health, because if you have brittle bones, you're not going to put on much muscle, or your body's not going to be able to support muscle gain. Okay, so very important. Then there are other items like selenium. Selenium is also very helpful for the diet. Selenium helps with the immune system and thyroid glands. It helps with ensure that men are staying supported when it comes to reproduction. Selenium is also an item that it helps with the fertility levels of males. So it is important that you get selenium on a daily basis. Three other things that I'll speak to quickly about is stress hormones. Men should manage the stress levels, and in ways of managing stress levels is managing their cortisol or epinephrine levels. That helps to suppress stress levels, and so you want to balance that and manage that a little bit carefully. And if you don't know more about it, we encourage you to do some research on cortisol, on epinephrine, understand how those things affect your body and also how they affect your health. Lycopene is one of the most important nutrients I can recommend today. Lycopene is also an antioxidant. It's a red pigment antioxidant. So any fruit or vegetable that has a red pigment, like our cherries, particularly tomatoes, are very, very helpful towards protecting against prostate cancer. Ironically, lycopene and red pigmented tomatoes are also very important for females when protecting against breast cancer. So tomatoes and the meal are very helpful for both males and females, okay? It also helps to remove inflammation in the body. It helps with sperm concentration and then also reduction of prostate cancer. And lastly, my biggest urge to men, not thinking just about nutrients or foods, but also thinking about exercise. Men, you need to embark on exercise at least minimum 3 days a week for minimum 30 minutes to an hour. The highest recommendation of exercise. You can choose anything to exercise. You can do basketball, you can play some tennis, any recreational sport. But it is also very important in combination with these recreational sports. Men should embark on stretching exercises like yoga or Tai Chi that helps to support the bone and the muscles growth. And also other exercises men should also think about weight-bearing exercise, because again, they also help to support bone and muscle growth, and they help to reduce the risk factors for all forms of prostate cancer. So my question to the panel today is that of all these nutrients listed, what is your favorite recipe? And please hope that the recipe you suggest is something listed in one of these nutrients here. So I'm going to go in the order of Naval, Nathan, then Glenn.
So my favorite recipe, and I'm a Chinese food lover, so I look at honey garlic chicken right now. Garlic, you see the health benefits, and it improves erection quality, maintenance, and digestive function. And digestive function is one of the key, I think, one of the key important things for me as well too. So definitely that would be my recipe.
Honey garlic chicken. Yeah.
The recipe I'll share is actually, you guys might think this is kind of comical, and I brought it here. I look at this list of nutrients, and that's each morning I have a protein shake, but it's also like a multivitamin as well. It includes things like the zinc that you mentioned on in the iodine. So not a recipe per se, but definitely take advantage of that and have some water with it as well, so a scoop of it and some water.
And Glenn?
Well, I would say salmon. I'm a big seafood lover. Fatty fish is one of my favorites because I love the texture of it. But salmon, yeah, is definitely one of those that I love to have. Also, definitely with a glass of red wine. So I think that's a pretty good combo. In
And mine,
moderation. In moderation, of course.
of course, and of course, it is important for me to also speak to the things I like. So when cooking meals, I'm thinking of baked chicken with some olive oil, some garlic in there, and throw in some tomatoes, some onions, get some green leafy veg on top of it. And then, of course, like I mentioned, a nice glass of red wine to finish it and wash it all down. Thank you. That's my thought.
All right, ready to dive back in. So let's get a little bit more in depth here, talking about testicular cancer. More specifically, looking at the risk factors, causes, and prevention, and then obviously we'll end it off with diagnosis. So the exact causes, and this is, I mean, I guess this is one of those things where you can call it a little bit of a mystery disease, but it's no one's quite sure. Um, and but there's lots of contributing factors that could be, and we hear this kind of lingo when we're talking about many diseases, because it's really hard to kind of pinpoint exactly what is the root cause. And I think in some cases where there's other contributing factors in diseases, it's, I think they're just theory-based guesses and we're not necessarily 100% sure. But obviously things like genetic predispositions and things of that nature are often ones that would help you keep I guess, a more watchful eye on if this is something that you can be exposed to at some point in your life. So again, it's just linked to a number of other conditions and genetic factors. Risk factors. Undescended testicle. So basically, if you ever heard about people talk about, oh, well, this, your testicles have not dropped. That's always a sign that you need to go, that you should go have checked out, just in the event that there could be a specific reason for that. Carcinoma, which is basically cells within the lining of the skin that can contribute to it as a risk factor. If you've had testicular cancer before, that's considered a risk factor, obviously. And being a certain race or ethnicity. So it was broadly said that this is found in minorities more than anything. And then body size. So body size also has a lot to do with it in terms of a risk factor. Now, in terms of prevention, prevention is hard. It's really, there is no prevention really for testicular cancer, and I was mentioning that before. But I think generally, just to keep yourself in a healthy state, keep your weight under control, and a lot of other things that we know that actually contribute to chronic diseases, like maybe not smoking, not drinking excessively. So I think generally just making sure that you have all around good health and you mitigate anything that can put you in a bad state regarding your health. So I mentioned before, early detection is a big part of it, and that is going to be your saving grace at the end of the day, because we've just mentioned that prevention isn't necessarily possible per se. But like I mentioned, if you know you're genetically predisposed, you're someone that should definitely be looking out for this in probably a bit more serious way than someone that is not. In terms of how this is actually diagnosed, so they use different methods like ultrasound. I mentioned blood testing before. Surgery to potentially diagnose a biopsy. So a biopsy is when, a surgeon would go in and take a small region or portion of your skin from a region of your body, and look at those cells and see if there's any cancerous activity happening. And then there's imaging. So sound waves, using X-rays, things of that nature. So that's kind of how it's diagnosed. yeah, and that concludes that. So I guess this kind of will push me into my question to you guys, to our panelists here. So what I'd like to know is, like, what strategies do you take as individuals to ensure that you have checkpoints established with your health, and what would be the frequency for you guys? So do you do just an annual physical? Do you do, biannually? Do you do it quarterly? So whatever you do to manage your own personal health, I'd like to hear that, and we can obviously start with you, Donovan, then we can go to Naval, and then Nate.
Sorry about that. I think it's important to have an annual checkup. I know some persons like to do it biannually. It's difficult right now with 2020 having COVID in the air. But I think those annual checkups keep you in, I guess, better accountability. But then in addition to the physician checkups and the physician visits, doing self-checks, looking in the mirror, feeling for yourself, using, touching your body, just understanding what's going on, what's there, what's changing, being more aware, being self-accountable.
Oh yeah, I would definitely suggest annual. I do annuals. I can tell you, to be honest with you, I never used to do annuals before, but I'm at the age of 29 now, so I definitely need to start jumping on those annual physicals. And just being aware of your body. I know a lot of guys, they know more about the function, every part of their car and its function, but don't know their body the same way, right? So definitely have those annual checkups. Will be highly recommended by me.
Yeah, like Naval and Donovan in terms of annual, and then kind of like a healthy habit that I try to practice in my life with friends is almost this unwritten rule of not only when we see each other, it's like, hey, how are you? But there's that question that we try to always remind each other of is, hey, how's your health? And we're already asking those type of questions. So it's, hey, how are you? And then at some point after that, it's, and how's your health? We always try to have that habit of, and how's your health?
Great answers, guys. Thank you.
All right. So my slide back on prostate cancer. So I wanted to speak about the importance of prostate cancer screenings. First off, you just want to inform you guys there's no real way to prevent prostate cancer because many risks such as age, race, family history can't be controlled. So there's no real way you can prevent it. There are like nutritional changes, like Donovan mentioned, being physically active that may slow the growth, but there's no flat out way to prevent it, right? So that's one of the key reasons why we have or we recommend prostate screenings. Also, it's important to note that different from testicular cancer, prostate cancer is very, very prevalent, right? So it's very, very prevalent, and the scary part of it is that not all men that they found out that they have prostate cancer experience symptoms. So that's the unknowing factor of it as well too. So a lot of men don't experience symptoms, and usually humans or even I'll say men, we tend to go to the doctor when we start to experience a symptom, right? So definitely these are why the screenings are important. Also, I have right on the slide here that for every 1,000 men between the ages of 55 and 69 years old who are screened, about 1 death will be prevented, and 3 men will be prevented from getting prostate cancer that spreads to other part of the body just by doing your prostate screenings, right? It's really, really important to note. And I also would suggest the recommended age, and I know they have different age recommendations, but I'll go on to lean on the Bahamas one, what was recommended by Dr. Gregory Pinto. At least by the age of 40 years old, you should start including prostate cancer screening in your annual physical. That's the benchmark age, and I think other jurisdictions may have it at the age of 50, 45, but I like the age of 40 because it's earlier. Starting to practice now. Started at the age of 40, right? All right, so there are different methods of screening. So we want to speak about the prostate specific antigen blood test. And that's the photo here on my screen. It's on the far left. with the blue cap on it. It says PSA test positive and negative. So with the PSA testing, what they actually do is they try to measure the amount of protein. They are trying to measure in nanograms the amount of protein or semen protein in your blood, right? So based on this measurement, if your PSA level is under 4, they call it 4 nanograms milliliter of blood. Sorry, 4 nanogram per milliliter. Sorry. They would say that you shouldn't have prostate cancer, or you're not in the realms of having prostate cancer. But if your PSA reading comes back and says it's between 4 to 10, they would consider you to do further testing, right? So you fall into this category where you may have prostate cancer. And if the PSA is over 10, there's a 50% chance that you do have prostate cancer. But we must know that with the PSA testing, that's not absolute, the defining answer. If you find your PSA is less than 4, that doesn't say that you don't have prostate cancer. However, if you see your PSA is actually within that 4 to 10 range, there are many other factors that may contribute to that as well too. So PSA testing, the prostate specific antigen testing is not the end all be all. Let me just share some of those factors with you that may contribute to a raised PSA level and might scare you, right? So we have situations where we have an enlarged prostate. I mentioned before that some enlarged prostates are not malignant, meaning cancerous. Some of them are benign, right? So that could contribute to that as well too. Older age, they also have an infection, older age, and then there's something called prostatitis. So sorry guys. And this is an infection or inflammation on the prostate gland. You also have a situation where individuals riding a bike, right? This also might contribute to increased PSA reading and may give you the false reading that, hey, you may fall in the category of having a prostate cancer. The next screening test I wanted to mention to you guys is the digital rectum exam. This is the one that everybody is scared to have all the time. But I would say, especially if your PSA falls within the category of, hey, you need further testing to determine if you have prostate cancer, I just want to suggest to all men that it's necessary that you may have to do the digital rectal examination. And I also want to mention to you as well too that it is okay to get this testing done, and maybe some instances we may need to get over ourselves as well, because we don't want to go to that region. I'm sure that the doctor is not excited to go there as well too. So definitely, if it's needed to be done, definitely get it done. So the DRE, or the digital rectal examination, is when the doctor uses the gloves, he lubricates his finger, and he inserts his finger in your rectum to feel for any bump or any ridges from a enlarged prostate. Remember when I said that the prostate is located right under the bladder, but it's right in the front of the rectum. So when he inserts his finger in, he's pressing down to feel if there's any enlarged, the prostate gland is enlarged. So that's what he is feeling for, because that's right in the front of the rectum. And it's also important to note that when the prostate gland does enlarge, it enlarges from the back, right? And that's where the rectum is. So basically, it's more easily, if you could look right here at my diagram, you can see where it's easily detectable from the rectum that way. And hence the reason why they have the digital rectal examination. Lastly, we have the prostate biopsy testing. And the prostate biopsy testing, I think, based on my research, is the absolute testing, right? And this is where, similar to when Glenn mentioned the biopsy testing under the testicular cancer. So the biopsy procedure is when they extract a small sample of your prostate and they look at it from under a microscope. So they examine that sample to see if there are any cancerous cells or any cancer activity is happening in your prostate gland. And this is basically, I would go ahead and say this is, highly recommended, especially if you're showing close symptoms of prostate cancer, the PSA level is in the range of maybe prostate cancer, and the digital rectal examination, the doctor is feeling some kind of ridge bump there. So the prostate biopsy will be like the test where they say, hey, we can make a conclusive answer on if this individual has prostate cancer or not. So the question I wanted to ask you guys in regards to prostate cancer screening, What things can we do to remind our men to get their prostate checked during their annual physical? Now, for me, I'll go ahead and answer this question first. For me, I know I've not reached that age for prostate cancer checks as yet, but I am going to guarantee you one of my alarm bells is my wife, and I'm happy to know that a lot of females are on this this webinar as well too, because you guys are the ones who reminds men to say, hey, go get your prostate check, make sure to do your annual physical, those friendly reminders. So that's one, and also selling the calendar within your in your schedule as well too. Let me just pass that question on to Nathan. What stuff would you say recommend to remind individuals to get their prostate checked during the annual physical?
Yeah, Naval, I was actually thinking very similar in terms of kind of like an accountability partner, and so you mentioned like someone who's a spouse, and then even for anyone, you could seek a health coach and almost hire a health coach. And one of the things you can mention to that health coach as you work together over time, just like you would if you're working with a personal trainer over time, is mentioning to that health coach that this is important to you. And so maybe on when they're making their plans or when they're writing notes, they also put it in their notes and their plans to remind you at this time, or to remind you when you go visit, that this is something that you ask. So having like an accountability partner in the form of a health coach.
All right, Donovan.
Sorry, guys. I want to echo something Glenn said earlier. He said that one of the best ways of staying on top of these visits is probably doing it annually or around your birthday. But I want to add into that. If sometimes, well, I had this conversation with my dad about having his prostate check or colonoscopy completed on his birthday, and he's like, I don't want to hear bad news on my birthday. And that's the reality. You know, some persons are afraid of hearing bad news on their birthday, or they don't want to be faced with those situations. But if you use other opportunities, use their siblings' birthday, their spouse's birthday, the offspring's birthday, the parents' birthday, use any birthday, or even annually as the new year starts and set a new appointment, you know. But have a mindset of doing it annually, and doing it annually on an annual date. So whether it's your birthday, someone else's birthday, or the new year, set a date.
Glenn.
So yeah, just going back to that that GP, man, your GP needs to be a good friend of yours, especially as you start to age. Because what I find is she'll actually give you direction. Now, your GP wouldn't necessarily be the executioner of something like a colonoscopy, etc. But what she will tell you is, hey, Glenn, now you're 40. You need to make it a habit from here on out to ensure that you get this procedure done every year, because it's, you know, it's a procedure that she doesn't necessarily do in house. So just knowing, you know, your dates and ages of what you should do and when. So another example, she'd be like, okay, so, you know, as you get to 40, you know, prostate exam every year. 35, make sure you get your eyes checked every year. So just things of that nature, and again, just making that GP a good buddy of yours.
I like that, building relationships with your GP. That's a good one. All right, guys, thank you.
All right, everyone. So we'll switch to our last content slide here. We'll switch gears back to men's mental health. And so just like we talked about testicular and prostate cancer and getting checked, the act of getting checked itself is something what's beautiful about that is that's within our control. We can go get checked, and that's something that we can do. And so just like with conditions, those types of cancerous conditions, there are things we can do for our mental health, because we know that the top of this slide shows that color range, the green to the red, and what that is referred to as what is called a mental health continuum. And so whether we're in a healthy range, whether in that kind of that middle range, at all points, we can have actions within our circle of control. And above all is that even when we are in a state of being healthy, or a state of green, we can still be proactive and build these different healthy habits right now to help ourselves for when times might become more difficult. And so this slide shares kind of two practical ideas that we can do to support our men's mental health. And just like professional athletes, they have a team around them, whether it be personal trainers, psychologists, the actual coach of the team, certain types of medical staff. Why can't we be our own types of professionals and build a team around us? And so we can look at that as we're building our resilience through interdependence. So we're building our support system. So who can we reach out to simply just listen? Who can we reach out to celebrate? Who can we reach out to provide a reality check at times? And we can establish our own team of individuals around us, and we're building our social support to support our mental health. And then in addition to that, when things might be difficult, what anyone can think about, and for the webinar, what men might be able to think about, is we can ask ourselves some questions. And we can look at these questions like mind over mood. And so sometimes our brain plays tricks on us, and in order for us to center ourselves again and to provide that perspective, the slide shares 3 types of questions. Whether these questions be, if I'm going through certain types of thoughts, what evidence do I have about that? We can look at probabilities. What are the odds of that happening? What are not the odds of that happening? So we're really thinking through our thoughts, and we know that we have control over this. And then we can look at if we can think of ourselves if we were at a helicopter looking down on our life, or if we were talking with a friend, what will we say to them? Because sometimes we ourselves are our most harsh critic, right? We can talk to ourselves and be so hard on ourselves. And so offering that perspective of, okay, if based on what you're saying, if a friend were talking like that or thinking like that, what would you say to them? And help us get that perspective to then get control of our behavior and our emotions. Because it's this type of thinking that really impacts the mental health hormones like dopamine, serotonin, oxytocin, and then the endorphins as well. And then we know, and when I really saw this image for the first time in the middle of the slide, this black and white image, is that we know this is a continuous journey. We can be healthy some days, then we go to reacting some days. We go through this continuum, and we know that even though some days might be easier, more peaceful, other days can go the other way. And so it's this continuous improvement journey of, it's not just one and done checkbox. It's each day, what can we do to take action? What's within our control to really take control of our mental health? And then as 3 nice kind of hopefully refreshing take-home points for everyone is that for all everyone who's listening, and for all the men who are listening, mental health is different than mental illness. And so someone who's going through a mental health experience is not someone who's necessarily dangerous. They're not someone who's incompetent, and what they're going through, it's not that it's permanent, because like we just mentioned, it's a continuous journey. So hopefully that kind of sets the stage about what's within our control for our mental health. And we know what we do from this practical perspective can help impact what happens at a cellular perspective, from a scientific perspective of like the different hormones and the different endorphins that go through our body based on the way we think. And what I'll do is, as a question to our presenters here, is I'm very curious from each of you, and we'll go Naval, Glenn, and Donovan, is would you like to share, maybe not anyone's name per se, but anyone who has a particular, who's in your life who you look to for a certain type of social support? So if you were to look at the list on the screen right now, is there anybody who jumps to mind who you would insert at, let's say, help me get my work done, be trusted? Really curious to hear what your resilience through interdependence looks like.
Oh yeah, so for me, I definitely have a few individuals in my life that I'm very fortunate to have to just give me that guidance. A lot of them as well too. I would say, well, I haven't lived crazy life circumstances, but nonetheless, though, they have lived crazy life circumstances. So it's good to know. I mean, good to speak to individuals that have been battle tested. That's what I call it. So they give, really, really good advice. And, you mentioned just now that we tend to be our harshest critic. So we definitely need that outside perspective when that individual could be like, hey, Naval, hey, Nate, you didn't do that bad. It was really good. Hearing that from their perspective, because, I think that we tend to put a load on ourselves because we know that we can do better. But then again, we still need to appreciate stuff that we actually done as well, too. So just gratitude. So in the spirit of Thanksgiving this week as well, too, it's good to be appreciative and grateful for the stuff that you have in your life as well.
So for me, I would say my wife kind of jumps out at me. Um, Naturally, I think a spouse is, tends to be the person closest to you. That's kind of your bed buddy, and kind of has an opportunity to see all of you in some aspects. But it also depends on your family dynamic because, my wife most recently, our youngest two kids are twin girls. And, they really gravitate to her and she's very, very maternal. So her capacity to contribute to those needs for me sometimes may not be there, and it's not her fault. So it's always good to have other support systems. Like my brother's a great one. He's not on the island here in Cayman where I live. But we've always been very connected. We can hop on the horn and speak anytime, especially in the digital age. So yeah, I would say those two individuals for me, Nate.
Yep. And for me, most persons don't know, I'm an only child, single child here. My parents are actually like my best friends. It wasn't like so growing up, but nowadays they're like my best friends. And so they're my biggest stronghold when it comes to mental health or support, and I can go to them for any and everything, and they give me very valuable and honest feedback. But as an extension to them, I have some very close friends. I also have a network of male cousins that I'm very, very close to. And I really encourage persons who have no support to find somebody. We have to find trust in somebody, whether it be a spouse, a relative, or a friend. But be mindful of also the persons we connect with, because not everyone's going to have your best interest at heart, and not everyone's going to have the best support.
Well said, and yeah, that's really refreshing to hear from all three of you, and thanks for sharing. And then we'll move on to our final slide here, and so thank you so much to everyone who is still tuned into this webinar. And what we could do for this slide is we can share some parting thoughts from each one of us as presenters for individuals based on all the information we talked about. What are some takeaway points? Donovan, would you like to start us off on that note?
I think my biggest point to everyone is understand, where are your risk factors? Are you an obese individual? Are you leading towards obesity? Are you in full control of your weight in terms of percent body fat and BMI? Second thing I would also like to say is, in terms of the list of nutrients we spoke about, read your nutrition labels. Understand that percent daily value of 5% or less is considered low. A daily value of 20% or greater is considered high. Anywhere between 6 to 19% is that yellow light. 5% means is a green light, which means go, it's good. Anything over 20% is a red light on a traffic light, and that means caution and be careful. So be aware of the nutrients you need, be aware of yourself, and motivate yourself. Things you need in life, exercise regularly, and eat healthy.
Thank you for sharing. Glenn, would you like to share takeaway points for the audience?
Absolutely. I think what I'd like to just encourage people to do as a takeaway is just remember, like, as we're going through life and we have fear of different things and things like that, don't allow a little prick of a needle every year to deter you from looking into your own best interest. Don't allow moments of discomfort to be the things that make you feel like you're less of a man or what have you, just because you're going through a certain procedure or whatnot. It's in the best interest of yourself. And also step outside of your bubble and think about your loved ones who would love to have you around as long as possible, especially if you have kids who rely on you and depend on you for, yes, resources, but just support and love. so that they can have their best life as well. So maybe within all this, just having like a moment of selflessness and realizing that even though it is about you, it also isn't about you, because there's people around you that care a lot about you.
Nicely said. And Naval, parting
Yeah.
thoughts for the audience?
Right. Yeah. I just like what Glenn said just now. Just hitting the nail on the head. It's not all about you all the time. But definitely my takeaway point of what I would suggest to everybody is to have so much more self-awareness. We have a lot of young men, or a lot of men dying young, right? And it's because of situations they are afraid to talk about. They're afraid to talk about the challenges they face, maybe economic hardship. You just alluded to mental health as well, and you see the rising statistics in regards to men's suicide. Men tend to not want to go to the doctor and check and see if, let me get a prostate cancer check, make my prostate check, because the test might be too invasive. But that invasive test may save your life, right? So these are, just some of the things that we wanted to do and just make this conversation a much more comfortable one, a welcome one. Like I say, I envy how females could just have conversations flat out like this without feeling, no quote unquote type of way. So we definitely want to see that with our men in the new century, to have these type of conversations and just have much more awareness. Know your body just like how you know your favorite team. All right.
It's amazing how much things like conversations, nutrients, early detection, how much these things really matter for us and our loved ones. And so thank you to everyone who tuned in for this webinar, who's still tuned into this webinar. For the Zest Wellness team, it's amazing to present this health information through these webinars. You can see the contact information to reach out to Zest Wellness is on the screen right now. And so with that said, thank you to everyone for tuning into this men's health webinar titled A Common Man. Bye for now.
Take care, guys.
Happy November.